Heart rhythm disorders affect more than 2 million Americans. The most common of these disorders is atrial fibrillation, or AFib. And although both men and women can develop AFib, women may face an increased risk of stroke and heart attack. I'm Shelby Cullinan, and this is a health feature. The heart has 4 chambers which contract to move blood through the body. The upper 2 are smaller chambers called the atria. The heart's electrical system sends out signals that tell the heart when and how fast to beat. In AFib, these signals become erratic. Instead of beating properly, the atria quiver or fibrillate. According to the National Coalition for Women with Heart Disease, a woman with AFib is 5 times more likely to experience stroke than women without the condition. So why is this? Dr. Anumeha Tandon, a clinical cardiologist at Baylor University Medical Center in Dallas, Texas, expands on the possibilities.
Now, we are still trying to figure this out, but there are certain theories that have been put across, one being that women's blood are more likely to clot as compared to men just because of certain clotting factors present in our bloods, for example, the von Willebrand factor. Second theory also is women take estrogen supplements, especially after menopause. And we've known from the Women Health Initiative study that that causes and predisposes them to form clots. So that could be one of the predisposing factors too. I think more investigation and research is needed in this matter, and we're still trying to figure this out.
There are other risk factors for AFib as well. The first is simply getting older. Although younger women can develop AFib, most women are diagnosed with the condition in their 60s and 70s. Dr. Tandon points out that women live longer than men, which increases their risk. Obese patients and patients with heart conditions also have a higher risk of developing AFib. Drinking alcohol heavily, smoking, and consuming high amounts of caffeine ups the risk. Other diseases such as diabetes, overactive thyroid, and high blood pressure also increase the risk for AFib. Dr. Tandon has more.
Well, there are certain risk factors which predispose you to having atrial fibrillation. For example, being overweight. That is one of the biggest risk factors, so monitoring and making sure your weight is at the optimum level. Second, sleep apnea is one of the biggest contributors for atrial fibrillation. Managing that and being compliant with your CPAP machine and reducing that risk factor is also important. So just some of the general things in maintaining your health which predispose you to having atrial fibrillation is important.
Additional risk factors for AFib in women may include high blood pressure, high cholesterol, migraine headaches, and using oral contraceptives or hormone replacement therapy. You can help reduce your risk of AFib, heart disease, and stroke by maintaining a healthy weight, managing your stress, and getting regular physical exercise, as well as making sure to work with your doctor on keeping other conditions you may have under control. Some doctors also recommend treating AFib with medications to make the blood less likely to clot. These medicines, called anticoagulants, can also help prevent stroke. So schedule time to speak with your physician on lowering your stroke risk and bettering your overall health.